new study finds disturbing news about the mental health of students.
According to the National Center for Education Statistics, 76% of public schools noticed more kids last school year with anxiety and depression symptoms than in the previous school year. Just a massive finding there.
Really
For more
concerning.
on this, let's bring in Amy Herbst. She's the Vice President of Mental and Behavioral Health for Children's Wisconsin. And you know, Lana and I have been talking about this. It's kind of incredible when you think of what children, school-age children, have been through the past 2 years, the past 3 years. How can we identify a student suffering from increased anxiety or depression, and how can we help?
That's a great question. Thank you for covering this topic. So in terms of identifying kids that might be suffering related to their mental health, it's really about talking to them. So making sure that you're engaging with kids, asking them how they are, if they're having any concerns or worries, and just really opening up those lines of communications. Kids will generally tell us how they're doing.
Well, we know the pandemic also contributed to a concerning trend in mental health. When we hear that statistic, though, 76% of schools are noticing an increase in the number of young people dealing with mental health issues. Do we have the amount of providers who can actually deal with that? Or is there a gap between the people who need services in young people and the people who can provide those services?
I wish I could answer this differently than I will, but we do have an issue as it relates to workforce. We have a workforce shortage of mental health providers all across the nation. And so that does impact access to mental health care for our kids and timely access to mental health care. So many of us are busy trying to solve that problem in a variety of ways, including very innovative ways, such as now providing telemental health care to kids. And that's helped us a little bit.
You know, even as an adult, we know that speaking about these things can help sometimes. You just mentioned that, you know, talk to young people and ask them questions. They'll be generous with what they want to say. But how do you approach that, wanting to also be sensitive that when a young person is suffering from these types of things, there may be other issues at play and you want to be very careful. So how do we help young people who are suffering in larger numbers now than ever before?
That's a great question. And how we can help our kids in terms of their mental health is by thinking about mental health the same as we think about physical health. Mental health is health. And so if we can treat it that way, then we can reduce the stigma around mental illness and around people asking for help related to their mental health needs. So there's an opportunity there to normalize mental health the same way we have with physical health. And frankly, the kids do a really good job of that. And adults could certainly learn from kids and their comfort level. But it's really about reducing that stigma.
Can you just give a quick example of what you mean when you say kids are really good at that? Like, what does that look like, a well-adjusted kid with anxiety and depression?
Yeah, so kids are very comfortable talking about their mental health. So it's not uncommon for them now to maybe in a school setting say to one of their peers, oh, that's my therapist right there walking down the hall. Or maybe they will be talking to their friends about how they're feeling and saying, you know, I've been very depressed lately and I think I maybe better talk to my pediatrician and my mom or dad about this. So they're just much more accepting and open in terms of their talking about it.
Which is encouraging. Maybe
Mental
this younger
health
generation is more
health,
open.
and we need to all acknowledge that.
Absolutely.
Yes.
Amy Herbst, thanks for joining us and speaking about this. We appreciate it.
Thank you.